Hello, my name is Andrew Smith. I'm Honorary Professor at the International Centre for Evidence in Disability at the London School of Hygiene and Tropical Medicine. My particular interest is in doing research and teaching on the public health approach to ear and hearing care. And I previously, before I was at the London School, I was at the World Health Organization in Geneva, involved with the Programme for Prevention of Deafness and Hearing Impairment. And I'm over here in New Zealand to help take part in a course on public health planning for hearing impairment. So today I'm going to talk about what I've called global public hearing health, the challenges and opportunities. So in terms of the challenges for global public hearing health, I would like to tell you about the size of the problem and the location of the problem. Another key challenge is the lack of awareness about ear and hearing care. And the third key challenge is the lack of resources. And then after that, I'm going to look at different opportunities. For example, the importance of the public health approach to hearing health. I will look at some examples of sustainable projects, particularly from low and middle income countries where most of the burden is found. I'll look at the role of WHO, and finally, just briefly, on the cost of not addressing hearing loss. Okay, so let's go to the first challenge, which is the size and location of the problem. There's recent estimates have come out from WHO, the global estimates of the size of the problem. There are approximately 466 million people in the world with what WHO calls disabling hearing impairment. That means moderate or worse hearing loss in the better ear. It's an average hearing loss taken at an average of 4 frequencies. And that's approximately, the global prevalence is just over 6%, 6.1%. And 432 million are adults and 34 million are children. And as I said before, 90% of the burden of hearing loss live in low and middle income countries. So that's why we focus our courses on the public health approach in these countries. Altogether, if you include people with mild hearing loss, there's over a billion, in fact 1,300 million, which is a 17% prevalence of any level of hearing loss. I should stress that these estimates are quite what you might call soft, because there's a shortage of data available to give accurate figures, but I'll come on to that in a minute. The size of the problem of hearing loss has been increasing over the last 30 or 40 years quite dramatically. It's been steadily increasing, and for various reasons. There's some questions around why the impairment is increasing. First of all, obviously the population has been growing. So even if the prevalence of hearing loss was the same, since the population is increasing, the numbers with hearing loss would increase. But also there's within the population, the number of older people is increasing quite dramatically, and that's in all countries of the world, not just in high income countries, but in developing countries as well, low and middle income countries. The number of elderly people is increasing because people are living longer, and the prevalence of hearing loss in the older age groups is much higher than the younger age groups. So as the population is aging, that's also a factor increasing the numbers of people with hearing loss. And probably also there's an effect of actually new cases of hearing loss coming along. There seems to be a kind of epidemic of noise-induced hearing loss amongst young adults and teenagers who are listening to their personal stereo, listening to music at high intensity. When they use the earbud headphones, it can produce very intense sound in the ear, and listening to that for long periods of time actually causes noise-induced hearing loss. A lot of people don't realize that, but it damages the outer hair cells in the cochlea of the inner ear, and can cause permanent hearing loss. So these people are at risk of a serious disability if they don't limit their exposure to noise. We need to raise awareness about that. So this just shows that the number of people in the world population is increasing over the decade from 2010 to 2020. The total world population increased by 11%, but for the over 65 years group, it increased by 37%. So you can see that there's a much bigger effect in the elderly, which is one of the contributors to the increase of hearing loss. And so 33% of over 65 globally have disabling hearing loss, and 7% in 50 to 64, and just 1.7% in children. And this slide shows the steady increase from 2015 up to 2050, the steady increase that is predicted to be seen for hearing loss by the WHO. And they've recently publicized this in World Hearing Day last year. They released this graphic saying, "Hear the future and take action now, because if nothing is done, this figure of 466 million, by the year 2050, it will rise to 900 million. So a huge figure there. So action needs to be taken, and this is where the public health approach comes in. This graph just shows the difference between the numbers of people with hearing loss in the population and the rate, the prevalence rate. So the columns show the numbers, that's just the prevalence, which peaks around the age of 60 to 69, 70 to 79. But then the numbers tend to fall off. That's just an effect in the population, that the older age bands have fewer people, even though those numbers are increasing, they have fewer people, but the prevalence rates continue to increase as you get to the older age groups. So that's because the older you get, the more likely you are to have a hearing loss. So the prevalence rate increases progressively. Even in the different regions, the WHO has shown that the likely increase is going to occur throughout all regions. We're in the area where it's called East Asia and the Pacific. In fact, there's a bit of confusion over the different ways of classifying regions of the world. The WHO used to classify this area, call this area the Western Pacific region. WHO is divided into 6 regions. So this was the Western Pacific region, which included all the low-income countries of Southeast Asia, China, Australia, and New Zealand. But now this classification here is similar to the World Bank classification. And so the East Asia and the Pacific are a low and middle income group, whereas Australia and New Zealand are grouped in the high income group. So the increase in the East Asia and Pacific group will be greater than the increase in the high income group. But still, nevertheless, there's a steady increase in both groups, as there is in all areas of the world. And this is a similar graph which is showing somewhat the same figures, but in a graphical form. And this graph shows that in all regions of the world, the prevalence rate in the elderly is by far the highest of all age groups, the prevalence. And particularly, it's highest of all in South Asia, which is mainly India, Bangladesh, and that part of the world, but it's about the third highest in the Asia-Pacific region, this part of the world. And also, one should take note, the various causes are increasing. So I've mentioned that the cause of hearing loss in the elderly is increasing. Also, the risk of noise-induced hearing loss in young people is increasing. Over 1.1 billion young people are thought to be at risk of hearing loss due to their recreational noise exposure. So it's a huge figure, and we need to raise awareness and change behavior in young people to reduce that risk. Also, chronic otitis media, that's discharging ears from the middle ear infection, is very high. About 330 million people in the world suffer with chronic otitis media. And in terms of inherited hearing loss, children who are born deaf, up to 5 children per 1,000 births children may be born deaf. So that's also another big cause of hearing loss. Another thing I wanted to mention in terms of measuring the size of the burden is something called the burden of hearing loss. We've previously looked at the prevalence, which is just numbers of people, but the burden of hearing loss takes into account the severity of the disability as well as the numbers. And this is part of a global movement called the Global Burden of Disease, which is looking at all health conditions and looking at the disability they give rise to. And this is disability in a general sense. Like any disease, you are disabled by that disease when you have the disease. The burden is measured by a measure called the Disability Adjusted Life Year, the DALY, which consists of premature death, that's years of life lost through dying early compared to the average age of death in the population, and together with the number of years lived with disability, which is multiplied by a disability weight. The weight is set between 0 and 1, so the higher it is, the more severe the disability. So that multiplies the years lived with disability to give you a figure which takes into account the severity of the disability. So when you do that, you just go on. You can rank all the conditions which contribute to this measure called years lived with disability. And in 2010, hearing loss ranked at number 11 out of all conditions. There's many more below this, below number 12, but this is just showing the top 12 ranking conditions in years lived with disability. So 2010 it was at number 11, 2013 it had shot up to number 4, again in 2015, and in 2016 it's gone up again to number 3. So this was quite a revelation to WHO when these figures first came out, because they really had no idea that age-related hearing loss, as shown here, was ranking so high in these ranks with years of life lived with disability. This is all diseases the disability caused from other diseases. The only things higher are low back pain and migraine. You might say, well, those don't sound very disabling compared to other conditions, but in fact, when you multiply the level of disability with the number of people, vast number of people have low back pain, for example, then that gives the ranking levels up there. So that understand. But so it's therefore, this is a good information for governments in terms of allocating resources. So since hearing loss is ranking at number 3, government should be allocating more resources to dealing with hearing loss if they allocated the resources in proportion to the positioning in these rankings, which they often don't do. So That was the first challenge. Second challenge, lack of awareness. So people are not aware generally what hearing loss is like. The people in the general public who've never had a hearing loss don't understand what it's like to have a hearing loss and how it can affect an individual. Also, they don't realize the cost to society. It has a huge cost, but people just never think of that. And they also don't realize that there are interventions available to either to prevent hearing loss or to manage it. Another issue about in the lack of awareness are the negative perceptions of hearing loss. People who are blind evoke sympathy, but somebody who is deaf just makes a normally hearing person irritable or irritated in trying to communicate with somebody who is deaf. And there's also a stigma to having a hearing loss. People are labelled as being deaf and dumb, or they used to be, and it's no longer that phrase is used, but children were thought to be backward, whereas really they were deaf in school. Hearing aids have a negative sort of connotation. You feel people were stigmatized by wearing hearing aids. So there are a lot of ignorance and a lot of negative perceptions which we need to get rid of and raise awareness about hearing loss. We also need to get more information about the true size of the problem, and because all these things lead to a lack of political will to deal with the problem. And that means there's an inability to prioritize for hearing loss. There's a lack of programs in countries to address it. And that leads to difficulty raising funds and therefore lack of resources in terms of human resources, trained people, equipment and infrastructure. So there's many areas that we need to address in terms of current challenges. We'll now move on to the last challenge, which is lack of resources. I'm going to look at information, people, policies and programs, hardware and funding. So information. We need to gather more information, more data on the occurrence of hearing loss. This map of the world shows sites where surveys were done using this WHO Ear and Hearing Disorders Survey software. I was involved with the development of this software and this protocol to do surveys, and I acted as technical advisor for these surveys. Although we went to quite a number of countries around the world, in terms of what you need for addressing a global issue, these surveys are very few in number. I mean, for example, in the blindness field, they've done many more surveys of the prevalence of blindness in most countries around the world. So this just brings to the fore the need for more data. And in fact, a study by this lady called Gretchen Stevens and her colleagues, this is an epidemiology group at the WHO, they reviewed over 3,000 studies, but out of that number of studies, they could only find 42 studies that were done in a sufficiently rigorous way to be able to use them to measure global and regional hearing impairment prevalence. And the two key conclusions they made were that the estimates of hearing impairment are uncertain because there are so few population-based surveys available. And secondly, that we need to do more cross-sectional population-based surveys, and they're urgently needed to determine trends, particularly in regions with the high prevalences. So that's the urgent need for information. Another challenge is people. This document was produced by WHO a few years ago to showing the availability of trained personnel in this field, which is very much lacking in low and middle income countries. In sub-Saharan Africa, for example, a lot of countries have either none or one or two ENT specialists. In Malawi, for example, which I know there was originally only one ENT specialist for 14 million people, which is a bit crazy. They've now gone up by 100% because they've got two ENT specialists now. But there's still a huge lack of ENT. Same goes for audiology. Similar lack. Of course, Australia and New Zealand are at the highest level for audiologists, but other countries in the region and probably the Pacific Island countries have got much lower levels of audiologists and also speech therapists. So there's a huge lack of trained specialists. There's also a lack of primary ear and hearing care workers. This diagram is taken from a set of guidelines we produced on hearing aids for developing countries, and it shows that most of the specialists dealing with hearing aids are either at the secondary level or the tertiary level hospitals, but there are very few trained people at the primary level of healthcare, which is where most people go to get medical care. And so we need to train more PEHC workers, primary ear and hearing care workers. Policies and programs. The WHO found that out of the 75 countries that responded to their survey, only 40 actually have government-initiated national plans or programs. So a lot of countries just have nothing. They have no national plan to deal with hearing loss, whereas most health conditions would have a national plan. So there's a huge need to develop national plans and programs. Hardware, this is looking at hearing aids. This table is a way of assessing the need for hearing aids, and looking at the red figures, these are the most recent figures. If you say 466 million people in the world have disabling hearing loss, subtract those with profound loss who wouldn't benefit from a hearing aid, and then you divide that number by 5 because the average life of a hearing aid is 5 years. That gives you the figure that's of number of hearing aids needed per year in the whole world if everybody who needs a hearing aid actually gets one. So 88 million, a huge figure. And at least two-thirds should go to the low and middle income countries. So that's about 70 million, and 1/3 to the high income countries. So that's about 17 million. So that's the need. But when you look at the availability, it's totally different. The total number of hearing aids that's being produced in the world, well, way back when I first did this assessment in 2005, it was about 7 million. I would say it's now gone up to about 10 million hearing aids produced per year. But in comparison to the need, it's a drop in the ocean. So there's a huge need for increasing the numbers of hearing aids that are produced. In addition, most of the hearing aids that are produced by the big hearing aid companies tend to be sent to high income countries. They prefer to have a business model where you have high cost but low volume types of hearing aids. So hearing aids are very expensive. People pay a lot for them and they're produced at low volume. We need to reverse the situation. So for low income countries, we have high volume and low cost so that people can afford to have hearing aids, but they're available on a large scale. So that's just hearing aids. And also there's batteries are also a problem, the availability of batteries for hearing aids. So, and this was just the press release which we had when we first released this information, and emphasizing then, this was in 2030 million hearing aids were needed yearly in developing countries. This figure has now gone up to 70 million. So still we're failing to address that issue in terms of equipment. So funding is the last challenge. So in WHO, the Prevention of Deafness program, they need funds because the WHO is short of funding. So we need funds maybe from external donors to fund the program and in supporting the people working in it. National governments need funds to set up programs and research organizations. In all of these areas in the field of hearing loss, there's a shortage of funding. And there's actually a mismatch in funding for hearing loss because in WHO and in donors, they tended to go and fund the sort of high profile diseases like TB or HIV/AIDS or malaria, communicable diseases. But the non-communicable diseases like heart disease or cancer, and also, of course, disabilities, sensory disabilities, they were less focused on than they should have been if it was funded in according to their burden. There's also a kind of fundraising trap. So to raise awareness about hearing loss, you need to raise funds. But funds are needed in order to raise awareness. So it's a kind of vicious circle, a bit like hearing disability in the poverty trap. Hearing loss leads to poverty, but poverty leads to hearing loss. So another economic poverty trap. So it's difficult to mobilize resources because of these issues that we've already mentioned.